Hi everyone, in the name of God, good morning, and I hope you're all doing well. It's a great pleasure to host you today in International Conference on Planetary Health Education in Nursing and Midwifery, ICPHE 2024, which its target is to empower nurses and midwives to lead sustainable healthcare for a resilient planet. It's a great pleasure to host you at Tom's today. I would like to introduce you the scientific committee first. First, we have Dr. R.P. Manukian, Associate Professor and Vice Dean of International Affairs, School of Nursing and Midwifery, um, Tehran University of Medical Sciences, Iran. Then we have Dr. Nasrin Nikpeima, Associate Professor, Head of Community Health and Geriatric Nursing Department, School of Nursing and Midwifery, Tehran University of Medical Sciences, Iran. And Dr. Mohammad Ali Charaghi, Professor, Nursing Management Department, School of Nursing and Midwifery, Tehran University of Medical Sciences, Iran. And also Dr. Shirin Shahbazi, Associate Professor in Reproductive Health and Midwifery Department, School of Nursing and Midwifery, Tehran University of Medical Sciences. These are some of our most prestigious and knowledgeable professors at TOMS, and we had the great value of had benefited from their knowledge. So that would be a great pleasure to be with them. I would appreciate all their time and effort. I know that they're so busy, and it was really precious for us to have them with us. So, then I would like to introduce Ms. Bahar Hassan Tabar for welcome and overview to panel one. So to introduce her, I have to say that she's Master of Science in Midwifery, Tehran University of Medical Sciences, Master in International Health, and Diploma in International Public Health, Charité Medical University in Germany, and she's also our international coordinator. So over to you, Ms. Hassan Tabar.
Thank you very much. Um, I would like to have an overall introduction and overview of our program. The esteemed participant of the International Conference on Planetary Health in Nursing and Midwifery, it is with honor and gratitude that I extend a warm welcome to you all. Your presence at ICPHE 2024 symbolizes a collective dedication to advancing education, fostering collaboration, and addressing the pressing challenges of our era, planetary health. To our esteemed colleagues from Tehran University of Medical Science, a beacon of health education and research in Iran, I express my heartfelt appreciation. Your leadership and unwavering commitment to nurturing future health professionals have been essential to this initiative, transforming an ambitious idea into a global platform for progress. This conference is more than just a gathering, it represents a shared journey, an opportunity to exchange ideas, build partnerships, and ignite transformative change. Each of you bring unique expertise and perspectives, enriching the event and reinforcing our collective mission. It is my hope that ICPHE 2024 becomes a springboard for innovation, collaboration, and meaningful action towards a sustainable future. What began as a simple idea to integrate planetary health education into the nursing and midwifery curriculum at my alma mater has blossomed into this remarkable global initiative. This achievement is the result of extraordinary national and international collaboration and tireless teamwork. The guidance and support of esteemed professionals have been pivotal in shaping this journey. From the outset, Dr. Sabina Banach's critical insight and expertise provided invaluable direction. Ms. Melvin Otino, founder of the Planetary Health East Africa Regional Hub, brought invaluable insight and introduced us to her extensive network for advocates, greatly amplifying the reach and impact of this initiative. I am deeply grateful for her energy, generosity, and steadfast support. Dr. Ivan Maria Schweinhorst Schicht, leader of the Sophia Planetary Health Project, served as an inspiration. On the national level, this project has been championed by outstanding professors in nursing and midwifery. A special thanks go to Mrs. Nusha Poursaudat, our national coordinator, for her dedication and collaborative spirit, which unites educators and students to bring this vision to life. To Dr. Manukian, Dean of International Office of the Nursing and Midwifery Faculty, I offer my sincere appreciation. Her international perspectives and unwavering support elevated this project, ensuring its success. Her dedication and innovation solutions have inspired confidence and excellence at every step. I extend my deepest gratitude to Dr. Nasrin Nikpema, our scientific lead, whose scientific expertise and innovation perspectives on planetary health and nursing have been vital to the success of this initiative. Her guidance and encouragement have set a high standard for impact and meaningful contribution to this field. My heartfelt thanks also goes to Dr. Shirin Shahbazi, whose insightful contribution and steadfast commitment to midwifery education and research have significantly shaped this initiative. Her collaboration has been invaluable in aligning this project with midwifery goals, empowering the next generation of midwives. I am profoundly grateful to Professor Muhammad Ali Charaghi for his philosophical insights and inspirational guidance. His reflections on nursing as a calling to serve a greater purpose have enriched this initiative, fostering a vision that transcends individual efforts and strive for collective excellence. A special thanks to Dr. Human Shahsabari, the Dean of the Nursing and Midwifery Faculty of Tehran University of Medical Science, that supported us in this initiative. Additionally, I extend my gratitude to Professor Abbas Tagizadeh and Dr. Takian from the Public Health Faculty at Tehran University. Their dedication to advancing in a faculty collaboration has been a source of inspiration, illuminating pathway for broader and more impactful work in planetary health education. This conference optimizes the spirit of collaborative and shared purpose. It is a teamwork and selfless effort with the goal of leaving a meaningful legacy for future generations. Through this initiative, we strive to empower nurses and midwives, key pillars of community health, to respond effectively to planetary health challenges. We carry a message of hope and commitment to look forward, to prioritize the well-being of our communities, and to honor our responsibility to Iran and the world. Together, we envision a sustainable and equitable future for all. Above all, this conference is about people, especially the most vulnerable to the impacts of planetary health challenges. It is a call to action for humanity to care deeply, act wisely, and live harmoniously with all the forms of life on our shared home Earth. With heartfelt gratitude and best wishes, Bahar Hassan Tabar.
Thanks a lot, Ms. Hassan Tabar. Thank you for your comprehensive speech. And before going to our scientific part that I know you're waiting for a lot, I would like to invite you to watch a video about our campus, School of Nursing and Midwifery, Ontario University of Medical Sciences, and I hope that you enjoy. Thanks for watching the video. I hope that you enjoyed the video as much as I did. So now it's the time to invite Dr. R.P. Manukyan, who I invited before and introduced you before. She's a great and knowledgeable professor and also one of the members in scientific committee. Uh, to talk about her more, I have to say that she's associate professor, Weinstein for International Affairs, School of Nursing and Midwifery, Tehran University of Medical Sciences. I would like to ask her to start her speech about planetary health, Tom's journey, and vision. So the floor is all yours, Dr. Manukyan. We're all ears.
Prestigious guests, esteemed professors, colleagues, and lovely students. On behalf of Nursing at Midwifery School of Tehran University of Medical Sciences, it's a great pleasure for me to welcome you all to this event. The Nursing at Midwifery School, with a history of over 80 years of education, as the first ranked school um, among 206 nursing and midwifery schools of Iran, which has been pioneer in nursing and midwifery education in Iran, today is honored to take the initiatives to bring together the experts from different academic disciplines around the world to share the ideas and to explore the developing areas of education for planetary health in nursing and midwifery. Actually, nurses and midwives possess enormous potential and they are uniquely positioned to play a leading role in planetary health. In my opinion, I think this is because of the fact that they are the professionals who acknowledge that human health and dignity are intertwined with the vitality of our planet. Well, since I brought up the concept of dignity, which absolutely is cornerstone of nursing care and midwifery field, and also my own research interest, I want to highlight the ethical perspectives raised from planetary health science. In my opinion, planetary health science teaches us that each one of us is deeply connected to every other person in present, in future, on this planet. Also, I can say that this concept teaches us and reminds us that we have shared humanity. Meanwhile, it acknowledges that every decision that we make, whatever we do, and even how we get around, all these factors can impact on our planet's natural systems and consequently the health and well-being of everybody else in this planet. So the Nursing and Midwifery School of Tehran University of Medical Sciences aims to raise awareness on this holistic, novel, and interdisciplinary concept. And we hope that by working together, by developing our international cooperation and finding the common grounds, uh, we will be able to actually integrate the knowledge that generated from different areas of research into actions that will promote health. And meanwhile, we will be able to find solutions for sustain our natural world. Thank you very much. And I hope that this international conference will provide fantastic opportunities for all of us to learn from each other. Thank you.
Thanks a lot, Dr. Manukyan, for your informative and comprehensive speech. Before going to our special guest, I have to apologize you in advance for any mispronunciations that are unintended because, we have a lot of prestigious guests from all over the world, and this may happen because of some cultural issues and language barriers. I apologize you in advance if I mispronounce your name. I don't want to be disrespectful. So I know that you're waiting for our special guest, Dr. Amir Hossein Takian. It's a great honor for me to introduce him and invite him to come. So his affiliation is so long, and also his reputation is also the same. He doesn't need to be introduced. He's all known about with his research and everything and knowledge. So he's a role model. I'm going to proudly ask Dr. Takian, who is professor and founding director, Center of Excellence for Global Health, School of Public Health in TOMS, and elected executive committee member in World Health Summit. So his topic is mega trends affecting planetary health. So it's a pleasure to have you, Dr. Takian. The floor is all yours.
Thank you very much. Can you hear me well?
Of course we can.
All right then. Good morning, everyone, and it's a great pleasure to be with you this morning. Nursing and midwifery community is in our hearts everywhere in the world because you are the people who serve the most vulnerable and as the pillars of the health system everywhere. Nursing, midwifery, nurses, midwives, and all allied health professionals, specifically these two disciplines, are the core to resilience of the health system. So when Dr. Manoukian, my great friend, asked me to join this conference as a special guest, I found no honor more than this, to somehow seize this opportunity to discuss with you some things that you know and somehow share with you the megatrends which affects planetary health with a specific focus on midwifery and nursing and why it matters for your community. I'm not sharing anything new, somehow building upon my research experience and some global reports. What I'm going to do is somehow setting the scene to see how planetary health is affecting the life of everybody these days, everywhere in the world, irrespective of the context that you are. And hopefully this somehow is some food for thoughts and then a platform for further discussion. Okay. Why nursing, midwifery, and planetary health? I was thinking actually why it matters to everybody, and specifically this community that you have this meeting today. And I thought maybe planetary health and its consequences on citizens affects the health of the population, affects the well-being of the population. And that's why there is a need for deep understanding of the consequences of climate change, planetary health in planning and policymaking. So you as nurses, midwives, all healthcare professionals, it's not just a matter of understanding the consequences of planetary health in order to serve the citizens. That's very important. But some of you are involved in decision-making, in planning for the health system. And for that particular reason, you need to understand how climate change affects the resilience, the structure, the facility that you are running your services, and in order to be prepared, adapt, and mitigate the consequences of these adverse effects of planetary health. And specifically, when it comes to the vulnerable citizens. So many of you, as nurses, as midwives, you serve mothers, children, vulnerable citizens, the poor, the elderly. And unfortunately, the vicious cycle of the adverse effects of planetary health is the way that these poor populations, this most vulnerable population, are affected the most. Let's maybe begin with this very important report, which I encourage all of you to have a look, from the World Economic Forum. Last year, they published a report called the Global Risk Report 2023. It's a long report, but it has lots of shocking news. They have asked people about the risk by the severity over the short and long term. When it comes to 2 years' time, it's the cost of living, natural disasters, and geoeconomic confrontation and failure to mitigate climate change. When it goes to 10 years, you can see on the right-hand side, you can see that the failure to mitigate climate change and climate change issues and planetary health issues are the major risk, not just to the health system, to the humanity. So colleagues, ladies and gentlemen, I want to draw your attention to this particular important issue, which is not just the health, it is humanity, it is civilization. So when we speak about planetary health, we need to look at that, and specifically when it comes to our region. I will have some information to share with you when it comes to our region. It is much more severe. It's a matter of humanity. And if you look at the down part of the shape, we can see that these are a very interconnected world that we live in. It's not just the planetary health affects our health. Planetary health affects democracy, affects the political system, affects the way that we earn, affects the employment, and everything you can imagine. So you can see my first very shocking and fundamental message is looking at planetary health as the pillar of civilization, as the cornerstone of humanity, and as a kind of fundamental aspect of sustainable societies. So sustainable societies are important for living. And when it comes to planetary health and the way that we are somehow affecting that, it's very dangerous. Some megatrends. One of the biggest megatrends, which I'm going to spend much of the time today, is climate change. So we live in a world which is becoming warmer, and the cost of living is rising. And we have had the warmest years on record in the history in the last few years. So you can see that we are somehow passing the threshold of warming in a way that our life is being affected. I will talk about that in more details, so I leave it for now. The second thing is the rising burden of non-communicable diseases and its risk factors, for instance, physical activity, unhealthy diet, smoking and other things, air pollution and other things. Again, the vicious cycle is planetary health and climate change. It makes it difficult for doing physical activity outdoor. And the lack of physical activity contributes to the burden of NCDs, like the cardiovascular diseases. So you can see that this interconnected and very simple, yet shocking connections between these different components affects our health in dramatic ways. The another thing on the right-hand side, on the top right-hand side, is the disease outbreaks. It's not just the COVID-19 since 2020, which affected and somehow devastated the whole world and somehow started the new health order and the paradigm shift, not just in health system, in almost every aspect of human life. It's more than that. It's the outbreaks and pandemics are going to affect our life in the future. It's not just a matter of other pandemic happens or not. It's a matter of when it's going to happen. And it is very likely to happen. So we need to be very ready. And these pandemics are affected by planetary health in dramatic ways. Look at the southeast of Iran, for instance. Now we have some emerging diseases like dengue fever, which kills people, or chikungunya, or influenza, or malaria. They are all coming back. We were on the edge of getting rid of malaria and malaria elimination in this country. Now we have domestic cases of malaria, which happens because of global warming and the planetary health. So this is something very, very important, which affects not just nurses, everybody in the community. And demographic shifts. We are getting old. We are, because of the life expectancy, because of the advances in medicine, advances in humanity, and all these facilities that we are enjoying, that's a good thing. Life expectancy is rising. That's the good news. On the other hand, life expectancy rise in line with poverty, lack of resources, and the communities which cannot afford enough health system and other aspects of the social services, they face big consequences. And you can see that climate change and planetary health side effects affect those vulnerable and elderly in more dramatic ways. So that's another thing that we need to think care of. The Institute of Health Metric and Evaluation, that's very important organization in the United States. I'm sure you know that this is the organization organization which publishes and somehow runs a global burden of diseases study, they have published 11 global health issues to watch in 2023, according to the experts. And you can see many of these issues are there. Long COVID, for instance, again, mental health issues, and mental health issues, again, are being affected by planetary health. I'll come to that in a minute. Population aging, dementia because of that, poverty, and raise of inequalities. Colleagues, we live, I don't want to somehow make you very fearful of this very unfortunate situation that we have been facing and is going to rise. But this is the reality. And this reality of multiple complex challenges, many of them affected from planetary health and climate change, are in front of us, and they are exacerbated by many other things in countries, like the lack of resources, lack of the decreasing general domestic product of the countries, decreasing democracy, the rise of populist governments and far-right governments in many countries, including the United States, which makes it difficult to have a kind of global effort in order to address these challenges. So we need to think about this, and we need to do something. I like this report. It's a bit old. RAND Europe in 2018 did research, and they went to the streets on Europe, and then they asked people about what do you think are the key trends of the current healthcare. And these are the ordinary people saying this. And among those, you can see the mega trends which affects us. Aging, for instance, again, aging is there. Rising health inequalities, you can see that the poor becomes poorer and the rich becomes richer. And the gap between the poor and rich is not just a matter of health, it's a matter of social security, and is the matter of how the responsible citizens contribute to somehow mitigate or adapt the consequences of planetary health adverse effects. And this is another thing, the second important issue I want to raise. So rising inequalities is not just a matter of eating or having access to the resources. It's much more than that. The increasing influence on unhealthy lifestyle, unfortunately, again, planetary health affects this as well. You can see that because of planetary health, the cost of healthy diet is rising. Even in this country, if you want to buy something very healthy, this is the case almost everywhere. Healthy food is more expensive than unhealthy food. And because of the size of families, and because of the unemployment, and because of losing jobs, and because of unfortunate economic situation, so the poor has no choice than going to the unhealthy lifestyle. We have enough evidence that the people who more smoke, are addicted, or eat more fat, sugar, and unhealthy diet, these are the poorer people. And this is the vicious cycle. And why planetary health is important? Because planetary health adds to the cost of food and the cost of living, and then this affects the most vulnerable more. So you can see this is the vicious cycle. And increasing the burden of mental health, specifically for children and elderly. And the last but not least is very interesting, saying that antimicrobial resistance and infectious diseases for the upper respiratory system and the more. Another mega trend is rapid urbanization. Look at the graph on the down of this shape. You can see that just 25 years ago, across the world, we have 10 megacities of more than 10 million population. 10 years back, it was 28, so almost 280% increase. Now, it's 41 cities across the globe with more than 10 million population, including our city of Tehran. So you can see that we are expanding urbanization. Why urbanization matters in planetary health? Because urbanization is the beginning of the disaster for the planet. When you come to the city, you abandon the rural setting and producing food and resources for the country and contribute to the air pollution, crowd communities, increasing infectious diseases, and the air pollution, which decreases the physical activity, and the vicious cycle of non-communicable diseases, infectious diseases, air pollution, climate change, precipitation, and all these consequences. So rapid urbanization is the huge issue and huge megatrends, which is unfortunately, which is going to worsen by 2030 by 41 cities and 63 cities of 5 to 10 million population. Look at our own country, Iran. 40 years back, our population was less than 40 million. Now we are about 90 million in 4 decades. And on that time, almost 80%, 75% of the population were rural in rural settings. And now almost 82% of the population are in urban settings. And you can see that even now, your very important conference is going to happen virtual because of the air pollution and because the city is shut down. So this is the living that we have, and this is going to worsen, unfortunately, and because of the urbanization, not just in this country, almost everywhere. Aging. Again, aging affects all aspects of our life, and planetary health, which I come to that in a minute. I haven't started my talk about planetary health. I'm just talking about the megatrends, and then I go to the climate change in specific definition and some specific trends of that. You can see that aging is increasing. I mean, the number of elderly, and you can see at the pyramid, demographic pyramid, if you look at that, you can see the number of people over 65 is increasing dramatically over the years. And why aging matters? Because aging traditionally is equal to more diseases, more risk factors, and being more vulnerable to the consequences of climate change, global warming, and planetary health. And this particular issue affects in our country in more dramatic ways. Again, look at, say, 75 years ago, the proportion of population 60 years or older is increasing almost everywhere. And if you look at the average of the world, which is on this dark bar, you can see that some countries, like the more developed countries, are much less than the world average. When you look at the less developed regions, are much higher than the high developed regions. So what it means is we live in the world, including our own country, Iran, and sub-Saharan Africa, and many countries in the Middle East, which are getting older much faster than other countries, which means that we have less resources to address the vulnerability of this population because of the climate change consequences on those things. Look at the consequences of aging on the healthcare system, for instance. Social changes. In Iran, you can see that the demographic changes affects almost everybody. So we have the senior citizens who are retired. Their retired pension is not enough for living. So they are in the streets for demonstration and this kind of things because they don't have enough resources to live. And then the healthcare cost of this population is very high because they are suffering from more comorbidities and multimorbidities. The infrastructure is not enough. The economic impact of aging, because if you are older and you have more retired people than working population, so you don't produce enough and your resources comes down. In this country and even in high-income countries in Europe, you have the workforce shortages, and specifically, this has been exacerbated after COVID-19 pandemic when many nurses and healthcare professionals had just walked out from the health facilities and increasing healthcare demand. When you have more older population with comorbidities, then you have more demands on the health system. So again, this is the vicious cycle of being elderly and having more elderly population, which are very, in terms of our own culture, elderlies are the source of prosperity. They are the source of cultural transition for our children. So we are facing the good situation of having our grandmothers and grandfathers living longer. And unfortunately, the healthy life expectancy of this group of population, these senior citizens, is less than the life expectancy. And that's why they are suffering in the end of their life without enough resources. And this is becoming exacerbated of the planetary change. Now, I want to stick to something which is the most important part of my discussion today, something about climate change. Many things, colleagues, that I'm going to share with you are like the common knowledge, you know. It's just for somehow summarizing the main effects of climate change and see how we can actually address those aspects in our day-to-day life, and specifically when it comes to healthcare professionals like the nurses and midwives who are the more focus of this particular meeting today. Look at this task. This is climate task in the middle. I'm sure you see this, this figure. This climate task is very important because this is something which shows us we are changing the world. We have actually changed our mother planet which is so far the only place on this galaxy that we can live on. We have done lots of research, and unfortunately, there is no other place than Mother Earth that we can live on easily like this. But we have done bad to our Mother Earth. We have destroyed our planet. And if you look at this task, this shows some parts of the task are really hot, burning, like set on the fire. And if you look at other parts of the task, they are cold. So you can see those consequences in those pictures. Look at Zayan Darude in Isfahan on this picture. This is heartbreaking, isn't it? This is Zayan Darude, which was one of the most important pillars of our civilization in this country, in this very historical city of Isfahan. When you look at the bottom of the Zayan Darude, which is like the desert, this is heartbreaking. Why it has happened? Because of a water scarcity and the way that we have managed our water in this country. In this country, with thousands of years of civilization, our ancestors were able to manage the water resources in a way that even the country, which was 80% desert, even you go to Yazd, they were something like Ab Anbar, the water storage. Ab Anbar was for managing water at the middle of desert in a way that they never faced water shortages. But we have done really bad. And that's why Zayan Darude is like that. And at the same time, just less than 150 kilometers from Zayan Darude, we have floods in Lorestan. So floods and drought are the two sides of one coin, which somehow demonstrate how bad we have managed our planet. Why I am eligible to talk about these issues is because in the course of last 5-6 years, I have been doing extensive research on climate change and how we can actually, along with my colleagues like Dr. Sotahizadeh, Dr. Nadrafi, Dr. Abdalan, and many other colleagues, I have been constant, one of my main research lines in terms of policy making, because I come from the global health policy making arena, that's my specialty. I have been working on these things for the sake of more evidence-informed policy making for our own country. So I've put some of the papers and some of the publications we have done and a number of research projects in terms of PhD I have been leading on in order to understand how we can address the consequences of climate change and improve our planetary health in this country. So what I share with you are somehow aligned with my own research, and I have been working and have been reading and doing research at the international level with some global colleagues in terms of understanding those consequences. Colleagues, this is an important shape. I'm sure you have seen it, but I just want to summarize why planetary health matters. My third message to you is planetary health matters because it affects almost every aspect of our life. Look at this: health-related illness, cardiovascular diseases, asthma, injuries, forced migration. Again, I have been doing international research and I'm advising the United Nations on migration and health. And that's why I'm somehow at the heart of decision-making for refugees health in this country and somehow at the global level. And I'm aware of the consequences of climate change, not just for migration or refugees, even internal displacement. In my country, if you look at South Khorasan province, in the border of Afghanistan and Pakistan, hundreds of villages on the border, which are very important for our national social security, have been abandoned because people have been forced to leave their villages, their cities, because of water scarcity. And it's not just a matter of internal displacement for those people, which is very unfortunate. More than that is our national security on the border, which is becoming compromised. So you can see that planetary health not just affects our health, our work personnel, health or healthcare personnel, it affects our security as the pillar of sustainable society. So you can see that, and mental health impacts of that as well. So again, today, look at us, citizens in Tehran, mega city of Tehran, of over 12 million population. Air pollution makes us mad. When we have an accident, rather than discussing with each other and going to the insurance, we try to hit each other. Why that's the case? Because the mental health of us is affected. Who knows that what proportion of the population are affected by the air pollution in terms of mental health, in terms of their tolerance of each other? We are not tolerant people. Our community is being affected because, not just because of the climate change or the air pollution, many other things. Among those are climate change. Allergens, water scarcity, changes in vector ecology. My colleagues now, they are in Sistan and Balochistan in the southeast of the country to somehow understand why this many re-emerging diseases are coming back. And this is mostly about climate change and the aspects of climate change which affects us. And let me concentrate on our region. 2 years back, along with some colleagues who are the biggest names in global health, some of them are the global scholars of global health from across the globe, I wrote a piece in the International Journal of Health Policy and Management just before the COP27 Conference of Parties on Climate Change in Sharm el-Sheikh in Egypt. And I invited the leaders of countries to consider, because the COP27, which is the conference of parties of the head of states and main decision makers, the last one was in Baku just a month ago, to discuss about how they can actually mitigate and put some money and resources and do good policy making to somehow address the consequences of climate change. I wrote the piece because it was the first time that COP happened in our own region, in Egypt. And then I said, the prospects and challenges for Middle East and North Africa, where our own country is located, are higher. And I invited the leaders of the world, along with these colleagues, as a kind of petition to look after Middle East and North Africa in the greater ways. Why that's the case? Because we, including in Iran, we are among the most vulnerable countries in the world in terms of the consequences of climate change. That's my fourth message. So this conference today that my colleagues at the School of Nursing and Midwifery at Tufts have planned to do is very crucial and important because Iran is located among the most vulnerable countries in the world based on the data which I share with you in terms of water scarcity and being prone to natural disasters and the consequences of planetary health devastation that we are facing. Like, for instance, water scarcity. If you look at this down, we can see that among the countries with the highest degree of water scarcity, we are there. So that's very important to understand. This slide is very important. There is one report called Ecological Threat Register. If you look at the vicious cycle from deteriorating resilience, you can see that planetary health matters. My main message of this speech today locates here, colleagues. Look at that. Pay attention to it. You can see that we live in the world that the deteriorating situation of political instability, and you look at our own region, for instance, governments collapse, the war, the bioterrorism. Since October 2023, over 40,000 civilians in Palestine have been killed. Then in Lebanon, then in Syria, then in Yemen, then in Iraq, in Afghanistan, almost everywhere. You can see that this is the fading democracy and bioterrorism and wars and the conflict, which affects not just the health systems, affects all pillars of humanity. And then this affects the planetary health as well and the capacity to deal with the ecological threats. And when the government, there is no government, when there is the rebels who are running the country, when there is war and conflict and the countries are on their knees to just provide food for the population, then addressing planetary health is like a joke, isn't it? So that's why we need to think of these things. So we need to think of prosperity. Then you look at the average ecological threat register, and you can see that our area of Middle East and North Africa are among the most vulnerable, okay? Look at the bottom, which is shocking. Look at this. This is very important. And you as nurses, midwives, healthcare professionals, you are the most important people, not just in the health system, in the whole community in order to raise this. Look at this. These are the number of hotspot countries by region. You can see that our MENA after sub-Saharan Africa. And I saw that some colleagues from Africa are among the audience and the organizers. So this is for all of us. So sub-Saharan Africa is globally the first, the highest number of countries identified as hotspots of planetary health. Then comes to MENA, the countries in North Africa and the Middle East, including Iran. Then you can see that we are the most vulnerable. Then look at this. This shows the population, percentage of the population who believe climate change is the real issue in the next 20 years. You can see that Middle East and North Africa are the lowest. And then, unfortunately, in 2021, compared to 2019, the number of people who believe climate change is the big issue is deteriorating. This is the global research. This is the big shock and the big alarm for all of us. We need to do something. We need to raise public awareness, public understanding of these things, because we live in the world which is the most vulnerable part of the world in terms of planetary health consequences. But unfortunately, our general population do not believe, and their belief in those consequences and adverse effects is becoming down because they don't know. They are deprived of understanding. That's the important thing. Human cost of climate change is huge because climate change is a driver of poverty. When the Zayan Darud becomes like a desert, then farmers in Isfahan, they need to abandon their job, then the revenue comes down and the consequences come up. And unfortunately, in this slide on the left-hand side, you can see that the most vulnerable countries are the low-income countries. So again, in Farsi, we say harchi sange, mare pay lange. So it means that all stones to break the legs are for the poor. So unfortunately, the poor is disproportionately affected because of the climate change. That's the disaster that we need to address. An adverse impact of climate change, I encourage you to read this paper, which is a very interesting one, Climate Change Effects on Vulnerable Population, specifically in the Global South, where we are located, are really high. Adverse impacts of climate change exacerbated by inequalities, gender disparities, again, midwives, nurses, allied healthcare professionals need to be more careful about the women. We do have gender disparities in terms of the effects of climate change because women are most vulnerable in terms of health. They are mothers, specifically in single-headed families led by mothers. This is much more severe. Ineffective adaptation and mitigation, including our own country. Unfortunately, we don't have any meaningful adaptation and mitigation. Look at the weather today. From your window, you can see what's going on outside. Discrimination and neglect and research gaps. Another thing that we need to do, Professor Chiraghi, I ask your leadership and charisma to somehow foster more research agenda. How nurses, and I think one of the outcomes of this meeting today, which I call and I invite and I actually request you to pay attention after this meeting, is how we need to address the research gap in understanding how nurses and midwives can contribute to this agenda of adaptation and mitigation of the consequences of climate change. Let me spend a few minutes on this and then I finish. In October 28th, the Lancet report on Countdown on Health and Climate Change was launched. If you haven't seen this report, I encourage, as a healthcare professional, researcher, nurse, whatever, whoever we are, I think all of us, we need to read this very important and yet simple report, which is alarming and heartbreaking. This report has lots of information and data, and I'm sure in your own time you go and see and read it, but there's something which is very, very important about the consequences of that. Look at this. The fifth message of my talk today is the world is becoming more vulnerable to the adverse effects of climate change. Of the 15 indicators monitoring climate change-related health hazards, exposures and impacts, 10 reached a concerning new record. Look at the right-hand side, you can see that many indicators, which somehow, I mean, simply what it says is the indicators by which we measure the consequences of climate change. And you can see that 10 out of 15 are worsening, unfortunately. Heat-related mortality, almost 200% increase, record increase of mortality because of climate change, specifically for the elderly. Why I said that the elderly matters? Because those are more vulnerable. And the elderly dies more because of the consequence of climate change. And then when you look at the extreme precipitation is unfortunately increasing. Look at just over a month ago in Spain, in Valencia, in the east of Spain, there was a rain. So in 1 hour, it was almost 30 days rain in Valencia. And the whole city went on knees because of that. So you can see, and at the same time, we have drought in other parts of the world. So you can see this is the world that we are living in. And this is again the climate toss. You saw some places are flooding, some places are, and then extreme precipitation events over the time. We can see it's high. These are the slides are in the report, so you can see that. And then one thing in particular which affects you as nurses is a sleep loss. Because of climate change, many places, including our own country, and specifically in Kavir, in the desert area of our country, because during the night, the weather becomes really hot, people cannot sleep well. And sleep loss is the cause of death, is the cause of reducing productivity. And this is increasing, unfortunately, increasing in our country, you can see in the map. So sleep loss and lack of labor is one of those. Tree cover loss. You can see that deforestation and the forests as the lung of and as the respiratory system of the planet are somehow becoming lost. In our own country, in the course of last 4 decades, even though the country is almost 80% desert, in the last 4 decades, we have lost almost 32% of our forest capacity, almost 1/3 of forest capacity of a desert country. This is shocking. And this is somehow very important. And this heat can affect our health because specifically infants, the elderly, the number of days, I don't want to bombard you with these numbers, heat wave per person has increased dramatically, almost 14 days. And the physical activity, because when it is hot, when the air is polluted, the vicious cycle is you don't go out to do the physical activity, then almost 30% more hours per year are getting somehow exposed to the ambient heat, and then moderate risk of heat stress, like outdoor compared to 1990s, has increased dramatically. And heat stress can somehow decrease the capacity of working, labor capacity, for instance. A record high of 512 billion potential work hours were lost in 2023, which is almost 50% above the average. This is shocking. Almost 50% above the average. And globally, 1.6 billion people, or almost 1/4 of working age population, work outdoors. And specifically in low-income countries, again, the poor is being more affected. Lost studies. And a sleep hour loss due to high temperature increase by 5% compared to 40 years ago, which somehow reached a record of 6% in 2023. So almost 6% of the world population have this. There are many of these, but despite these odds, there are some signs of hopes. For instance, energy systems and health, deaths from fossil fuel driven outdoor air pollution fell almost 7% from 2.25 million in 2016 to 2.09 million in 2021. So, and almost 59% of this decline is due to the effort to reduce pollution from local burning. And this is because of the government commitment. So there are some good news happening as well because of the COP and other things. If you look at the economic evaluation, again, inequalities are there. The global potential income loss from the capacity reduction due to extreme heat reached a record high of $835 billion. This is like the economy of a country like, for instance, South Korea, and the loss of labor capacity. And if you look at the down of this shape, you can see that low human development index countries suffer more in terms of agriculture, construction, manufacturing, services. So colleagues, what I'm going to say is we are facing unemployment, loss of jobs, because of the planetary health adverse effect, which affects the poor nations more than others. This is another shocking thing. I'm trying to finish very soon. And when you look at that, we can see that, as unfortunately, the cost of heat-related mortality is going high. There are some numbers here. I don't want to repeat these numbers for you. I think I have somehow delivered the message I wanted to say. Another big issue, which is one of the consequences of planetary health, is antimicrobial resistance. Antimicrobial resistance is one of the biggest threats of global health, and which somehow leads to over 1 million extra deaths every year and 8.25 million deaths annually by 2050. And because this is the most urgent global health threats and development challenge, and which somehow challenge the global economy, And unfortunately, again, the poor and vulnerable are disproportionately affected by this. We need to address that. And we do have ample evidence that antimicrobial resistance is because somehow related to climate change and planetary health. Again, we have been doing some research on AMR in our own country, which if you have a time, we can look at that. Non-communicable diseases as the source of over 3/4 of deaths, specifically in the context of low and middle-income countries like Iran, is another case. And again, because of the affecting the risk factors of climate non-communicable diseases like unhealthy diet and physical activity, this is a vicious cycle. And on this subject, again, I have been doing extensive research to understand how nutrition, how non-communicable diseases are being affected by climate change. And finally, refugees and displacement. Look at these numbers, they're shocking. We can see that almost 70 million population are internally displaced people by the end of 2023. And this number of people, if you look at the downside of here, we can see that Iran is the first country receives refugees and displaced people in the world. So, and some of these refugees currently, I'm collaborating as a Lancet commissioner to we are writing a piece which will be launched next summer on the nexus of climate change and refugees. And I'm advising the United Nations and the World Health Organizations on that as well, which to look at how climate change and planetary health make people to leave their own countries. It's not just in low-income countries, even in Europe. In Europe, in Spain, when there's a flood, people go to another country to live because they lose their families, their houses, and the income, so they migrate to other cities. So migration is not just a social issue, is specifically a health issue, because these are human beings, legally or illegally, migrate to another country, to another setting, to another city, and then they need healthcare services. And in Tom's, everywhere in this country, you can see that you have Afghan refugees, they are seeking for care, they don't have money, and for humanitarian reasons, you need to do that. So my 6 point to you, specifically in our country, that there are millions of Afghan refugees, is climate change-induced refugee and migration. This is a theme about which you will hear a lot. And again, at the midwifery and nursing, Professor Chiraghi, Dr. Manoukian, and others, we need more research to see how we can actually address this, because this is going to be one of the biggest trends in the future. Again, I have been doing extensive research on this in Iran and other countries. We can see some of our international publications on that. So if you are interested, you are more welcome to have a look. These are the different publications I have been doing in the course of last 5-6 years in terms of refugees' health. Okay, my final message, colleagues. So far, what I've said is, we live in the world, which is very vulnerable. And as healthcare professionals and policymakers, I look at you not just as nurses and midwives. I look at you and expect you as healthcare professionals who have the involvements in policymaking and planning for the health of the population. If you look at the building blocks of the health system, after COVID-19, I think we are not ready in order to address the 6 building block of the health system, specifically when it is being affected by climate change. One particular issue is our facilities. Colleagues, look at the hospitals you're working in, healthcare facilities, for instance. Are you sure the extent to which that these facilities, even in terms of building, the standards of buildings are prepared enough to be in line with the requirements of global warming? If you have a patient in hospital, Imam Khomeini Hospital, for instance, and air pollution happens, warming happens, heat waves happens, floods happens, in this country, earthquake happens, all these issues, okay? Are we ready for that? Look at that. The extent to which our buildings are ready, that's the simplest thing. If we go to more complex issues, then even the case is worse in terms of financing, in terms of health workforce. Today, I am sure we will be addressing migration of nurses in this country and the lack of nursing and midwifery capacity, specifically nursing capacity in this country, even in the capital city of Tehran, and nurses who migrate from this country to other countries because of the monetary issues and the financial issues and the payment system, for instance, among other reasons. So this will be worsening, unfortunately, by climate change. And climate change-induced migration among nurses is something. So if you look at the workforce, you can see that the workforce is affected by that. And it is not just the case in this country. Even in Europe, in Germany, in the United Kingdom, in France, you have shortages of healthcare professionals, including nurses. So I don't want to, again, take much of your time about this, but I want to encourage and invite you to think about this while you are having this conference on planetary health and nursing. This is the most palpable issue in this country and many countries in the world, that the work of healthcare professionals, healthcare, human resources for health, and specifically nurses, are being affected. And that's because of the governance issues, the institutionalizational issues, for which we have been producing some research in the past. If you're interested, I encourage you to read. In order to address these consequences, let me give you some clues on what to do, and then I finish. We need more intersectoral collaboration. Intersectoral collaboration means that we need to foster meaningful mechanisms that nurses, midwives, physicians, healthcare professionals, and other sectors, not beyond the health sector, work together. And we need to improve our surveillance system in order to understand what is happening and in order to somehow prepare ourselves before something happens. And we need to have public and political engagement. When I said that this country, among MENA countries, are among the most vulnerable, and yet the public are not aware and they don't think that climate change is an issue, this shows that we have done our homework not completely. So we need to do something more. We need to engage with the media. We need to engage with the individuals, scientific engagement, political engagement, and doing something. In this is the Farsi column I wrote in the Dunya Iqtisad newspaper some years back, which talks about the triple diamond of governance, which is about the government, the nation, and the civil society. And this is very important in order to address the consequence of climate change. It's not just the government needs to do that. We need to do that. That's why I think the initiative that you are doing today and tomorrow in your conference is very, very important. We need to increase the social accountability of the government, as you can see in this piece that Dr. Nejatian, one of the premium figures in nursing, have been doing in his PhD research, and I have been involved in that research, showing that social accountability is very important in governance, and we need to somehow reach that. My final messages. Can we have a healthy future given this very dummy and somehow dark situation which I just painted to you? My answer is yes. We need to do something. One is prioritizing health in countries' updated climate commitments. You are nurses, midwives, allied healthcare professionals, whoever you are, we need to make health and well-being a key consideration in countries' nationally determined contribution in 2025. We need to redirect fossil fuel funds towards financing a healthy future. We need to, in this country, which is a very oil-dependent country, like many other middle-income countries or low-income countries, we need to shift the subsidies and investment from fossil fuels towards a zero-emission, healthier, and equitable future. And for that, again, we need more engagement with the society, with the civil society, with the public. So you can see that all the pillars I have mentioned so far are very interrelated. We need to account for health in climate finance commitments. COP28, which happened in Baku, other COPs, COP29 and other COPs, all are important. And all these opportunities. We need to have more of these gatherings with nurses, and nurses go to the physicians, and then nurses go to other parts of the society, and we need to have a dialogue, and we need to keep it alive in order to somehow sensitize the society. We need to set health and well-being as the key metrics to monitor climate action. This means that health and well-being should be at the heart of climate change and planetary health actions. So we need to prioritize. And COP29 and somehow COP28 in Dubai was somehow the kind of turning point in the history of COP, which somehow put health at the heart of climate change. We need to do it more. Planetary health and nursing, this intersection. So that's why, without any exacerbation, what you're doing is very important and crucial. Keep it up. And then to make health equity central to the just transition. Health equity matters. I showed some information and some data with you that more vulnerable, elderly, women, children, and those poor people, they die and they get more affected because of the adverse planetary health effects. So that's why we need to prioritize those and we need to have some plans. Even when we have the National Plan for Nursing, Dr. Nejatian, what we need to have is putting those elderly and vulnerable population specifically at the top of the agenda. We need to deliver a low carbon climate resilient health system. This is something which I talked about the health system. Now, even now, in my School of Public Health, the country is closed, shut down because of the lack of energy. But if you go to this building just behind me, you can see in the picture, you will boil. It's very, very hot. That's why you are using your resources and you have to open the window in order to not let it burn at the middle of winter. This is something about our brain, our governance, our planning, delivering low carbon health system, low carbon hospitals. And this is our responsibility in order to do that. Otherwise, we don't have enough capacity to afford the consequences of planetary health. And finally, delivering climate change gains by addressing the root causes of ill health. We do have ample evidence that heat waves, planetary health adverse effects kill people. So we need to do something. We need to address that. We need to do something which brings people at the heart of that and addressing this. And these are very, very crucial, strengthening the pillars of the health system in order to do that. And let me finish by somehow sharing with you this clip, which shows how hopeful we can be. Many people, when I'm talking about these issues in any conferences, I say, oh, Dr. Tachyon, you are very optimistic. How on earth we can do that? We need to somehow do our share and our proportion. So pay attention to the less than 1 minute video, which gives the message of hope. Please have a listen.
Dr. Tachyon, I'm really sorry for interrupting you, but we don't have the voice of your video.
Oh, sorry. Okay, what happens, what I do, you can see the video, then I translate to you and say what it is, because it's very short. Is that fine?
Of course, thank you.
Okay, sure. So you can see what is happening is this boy on the shore, on the beach, is throwing away the starfish into the sea. And then the wise man, the old man, comes and asks the boy, why you are doing this? The boy says, I am throwing away the starfish into the sea. And the wise man is telling the boy that, you know, this shore and this beach is very long. There are millions of these starfishes. And if you do this, it doesn't make any difference. And because it's just one of them or two of them. And the boy throws away one starfish into the ocean and say, I made a difference to this one. And then the wise man, who's a symbol of wisdom, becomes convinced that you can make a difference to one, and which makes a difference to, and even the small things can make a difference. And that's why we think that making a difference, even in a smaller scale, is very important. Let me finish by this sentence from Shift Seattle, saying, we do not inherit the earth from our ancestors. We borrow it from our children. And for our children, and for our community, and for our generation, we need to do something meaningful to somehow address the adverse effects of planetary health and climate change. Thank you very much for your attention, and I'm eager to enjoy your discussion if there's any question. Floor is yours. Thanks.
Dear Professor Tachyon, thank you very much for your informative and fabulous presentation. I really enjoy your presentation. I want to express my gratitude for accepting my invitation, dear Professor. Actually, it's a great honor for all of us to have a high-ranked professor and scientist like you with us. Thank you very much.
My pleasure. Thank you.
So I would like to express my appreciation to your brilliant speech. I really enjoyed it, and I'm sure that everyone has benefited enough because during your speech, I saw my friends eagerly taking notes. And I would like to recap your speech before going to Q&A. You talked about the concepts of planetary health, which is simple and shockingly effective. You told us about the interconnected dimensions of planetary health. It's how it affects our routine life, how it connects the diseases, communicable and non-communicable, the mental health. And you said what you said was really, I mean, touching and heartbreaking. That you said we have destroyed our planet. That was really touching for me. And I think the most important sentence you mentioned, you said it's a matter of humanity. So, planetary health is a matter of humanity. It shouldn't be ignored. It has to do with political things, with health system, etc. So, I would like to ask our audience to share their questions if there are any questions in the chat box. Please tell us, and if not, I have some questions that I wanted to ask you.
Sure.
So, we can wait for our audience to write their questions while I'm asking you my questions. Is it okay for you, Dr. Takia?
Absolutely. Just make sure that if someone wants to raise the question, they can have access to the microphone, or everybody has access to the microphone, or you just put in the chat.
They can write it in the chat box, and then we can give them access to ask you their questions. So first, it was really important for us to know that how can the public health faculty and nursing and midwifery faculty of TOMS can collaborate effectively on mitigation and adaptation strategies for climate change. I would really appreciate your answer in advance.
Thank you. Thank you very much. I don't want to pretend that I have answer to very important and complex questions. So the most important answer that comes from me, I don't know. But what I feel we can do, and this is the kind of food for thought and more discussion, is School of Public Health, we do have the Department of Environmental Health Engineering, and we do have the Research Institute for Climate Change and the Environment Research. And there's a research center in that, and Dr. Usta Taqizadeh, my colleague who is leading on that, is here as well. One thing in particular we can do is, because we produce evidence on how climate change affects the public health of the population, and then you at the School of Nursing and Midwifery, you are at the forefront of providing healthcare and doing research on health services and the way that you produce healthcare services for the citizens. So one important thing, if I want to be very realistic, is and because of this, the complexity of the issues, these issues of climate change is not just a matter of health system. Actually, the health system is one of the most important victims of climate change. We are being affected because the citizens get sick, they come for seeking healthcare, and then we need to provide healthcare on the basis of humanity as a human right, and without somehow much contributing to that. So one particular thing we can do, those complex issues needs interdisciplinary approach. So we need to define the most important and somehow palpable questions and challenges that you as nurses and midwives have, and then prioritize those in the kind of comprehensive manner. And then we sit down and say the extent to which we can address those and the extent to which you can do that. One particular thing is how our health, one is in the area of environmental health, which is about facility and disaster management, how we can strengthen the capacity of our health system facilities like hospitals, healthcare centers, or those places which are compatible with climate change. That's very important, for which we need standards, for which we need more research and more action. The second thing is you are facing the migration of nurses, specifically nurses. And then some of that is because of the climate change consequences. We do have, as I said, enough evidence showing that's the case. So again, the School of Public Health, when it comes to global health aspects of that, the human resources for health, economic evaluation, we can do some economic evaluation on that which brings enough evidence for the policymakers, and then going together and raise our voices to communicate. And finally, as I said, I advocate for engagement, greater engagement with the public and the media, because that's very important in order to raise our voices and reach to the policymaker. Because the media and the public, first of all, are not aware of this. Unfortunately, we need to train them and we need to produce the materials in their language and then engage with the media to sensitize the policymakers. Again, together we can do that. I guess one outcome of this gathering today and tomorrow will be more thoughtful and purposeful collaborative research, and not just research, advocacy between the two schools and the affiliated research centers in order to address these challenges in our own country and perhaps beyond. Over.
Thanks a lot for your answers. They were really informative. And I would like to ask you more. And you know that for promoting this concept in our country, there are lots of actions that we can do. I want you to prioritize them for us, please. For example, first, policymaking, raising awareness, I don't know, encouraging research. So what is your recommendation?
Again, it could be not very much evidence-based what I'm saying, but based on my little experience, what I can say is prioritization should be a kind of collective action. So again, if you have any declaration out of this conference, one which I suggest to you to do is putting that we have a kind of scientific exercise to prioritize among ourselves things and then be committed to that. Because if it is a collective action, then this brings the sense of ownership for all the stakeholders, and then this can lead to kind of more meaningful interventions. But in my very little understanding of this particular and complex subject, one thing, if we want to do, is defining interdisciplinary approach to that and identifying the stakeholders who are involved in that particular thing. And then when we define those stakeholders, then we need to establish a subcommittee or a committee, a special committee. It could be within TOMS, the core committee, in order to do different things. One is public awareness. At the School of Public Health, we do have the Department of Health Education and Promotion, and they do have extensive capacity and experience in engaging with the public. So they can go and do something with engaging with the public. We need to be taught how to engage with the media. We need to know how we do interviews and go into the media in order to increase the public awareness. Sometimes it's not just a matter of going to the media or the university. We need to go to our children. One particular thing which I encourage and I truly believe in is enhancing the understanding of our little children, even at the age of 4 or 5, about climate change. These are the future generations, and we are borrowing the resources, unfortunately, as I said in my last quote, and then they have every right to be a part of this. And to be honest, that's the most effective strategy. So we need to teach them. The curriculum of the schools need change. If we want to change the curriculum of the schools, this is a kind of multi-sectoral action. We need to go to the Ministry of Education and we need to work with them. In these meetings like this, we need to invite people from the Ministry of Education, آموزش و پرورش. We need to have muallims or teachers with us. We need to have the representatives of the parents with us. You know, Dr. Manoukian, recently, in the course of last couple of years, the global, very important and impactful conferences which I attend, I am truly thrilled seeing that ordinary people come to the conferences. They sit at the front row and they give a speech. They engage with the pioneer scientists. We don't have this kind of mentality in this country. We need to bring the public into the fore, engage with them, and strengthen the civil society. And the third thing, which I encourage us to do, is doing impactful research, not research, and producing evidence to somehow go to the policymaker and show them the evidence and advocate for that. By that, I mean economic evaluation, for instance. If we show to the chief of the budget and planning organization, Sazman Barname Budget, that these are the economic consequences of nursing migration because of climate change. We do have numbers, we do have figures. Then this can somehow shock them, hopefully, to do something. So interdisciplinary research, modeling, you can use system dynamics, for instance. We can use artificial intelligence-based research, which we have started in the school at the School of Public Health. In the last 3 years, we are heavily working on artificial intelligence, the intersection of artificial intelligence and global health policy making. I've done some research on that. Those things and the new avenues together, we can make a difference, and then we can expand this. But my main request to you is, even for this exercise, we need to sit down, spend time and do that. And I expected you to invite more policymakers, the members of the parliament, even from the Commission of Health at the parliament, to this meeting, because these are the things that they need to understand. They need to listen. They need to be aware of these things in order to somehow, hopefully, make a difference. Over.
Thanks again. So it was a pleasure and honor for me to audit you. We really learned from you. That was really, really, really valuable. Thank you for your time and effort. I know that your schedule is really busy. So our first panel is done.